International welcomes you to Community Health Volunteer Training, Module 6, Basic Healthcare. Objectives of the basic healthcare will be to identify common illnesses affecting children and adults in the community, to identify danger signs in children under 5 years, pregnant women, and general public, to demonstrate life-saving skills, to make appropriate referrals. In this module, we shall have 2 lessons. Let's start with lesson 1, healthcare skills. In healthcare skills, we shall have 3 sections: common conditions, common injuries, life-saving skills. Let's start with common conditions. Some common conditions will include cough. Coughing is a sign of other conditions. Short-term cough is a common cold. It can also be acute bronchitis, also pneumonia, malaria, whooping cough. Long-term cough includes tuberculosis of lungs, chronic bronchitis, asthma, lung damage from smoking, supportive management of cough. Drink a lot of liquids, for example, clean water, warm soup and tea. You should also rest. Prevention of cough. As shown in the diagram, do not cough openly. Do not cough openly. Cough in your hands. Do cover your cough with tissue, yellow elbow, or your shirt. When should we refer the cough? Any cough with fast breathing needs immediate referral. Cough 2 weeks or more could be as a result of tuberculosis, asthma, whooping cough, and need referral. The other condition is nosebleeds. Some causes of nosebleeds are knocks and bumps, picking, frequent nose bleeding, changes in attitude, high blood pressure, dry winter or summer air. Supportive management of nose bleeding are: do tilt face downwards and apply pressure on soft part of nose for a few minutes. Ensure pressure on nose does not obstruct breathing. Encourage client to breathe by mouth. Do not tilt head backwards. This may cause inhalation, gurgling, or nausea from blood running down the throat. When to refer? Refer if bleeding persists. Refer. Do not handle blood if you are unable to protect yourself with gloves. Eye issues. Discomfort or inability of eyes to distinguish objects or perceive detail, color, and contrast. Good eye health. According to WHO estimates, the approximately 1.3 billion people around the globe live with some form of vision impairment, 80% of which is either preventable or treatable. Vision is that at least 2020, eyes are disease-free. Causes of eye issues. Most common causes of preventable vision problems are dirty water or dusty environments, glaucoma, cataracts, uncorrected refractive errors, trachoma, diabetic retinopathy, onchocerciasis, river blindness. When to refer eye issues? If eyes are exposed to chemicals, fire or hot liquids, foreign body, trauma to the eye discharge, pus, eye swelling, crusty eyelashes touching eyeball. Prevention of eye issues are: you should maintain personal hygiene of the eye, Wash hands before touching the eyes. You should have an eye checkup for the person suffering from diabetes yearly. It helps address diabetes-related blindness. Use of non-prescription eye drops may lead to damage to the eye and blindness. Immunization and vitamin A supplementation found to be effective in reducing the risk of blindness. Ear issues, impairment of hearing or pain, supportive management of ear issues. One should clean your outer ear by gently washing it with a washcloth and warm water. When to refer ear issues. Children with ear problems may pull at the ears. We should refer the ear problem in case we have an ear trauma, in case it has an infection, such as tenderness, redness, swelling, discharge from the ear. When we have hearing impairment, foreign body in the ear. Let's go to prevention of ear issues. Safely remove excess earwax using over-the-counter earwax removal solutions. Avoid cleaning ears with sticks. Let's go to skin issues. These are scabies, tinea, jiggers. Let's start with scabies. What are scabies? These are rash, which are skin condition caused by a burrowing mite. Signs that one has as scabies. Itchy skin with very small lumps, found between the fingers or on the wrist, around the waist and genitals. Signs of scabies: itchy skin with very small lumps, spread by touching the diseased skin of an infected person or by touching clothes or beddings used by the infected person. Supportive management of scabies: tell the mother to wash the clothes with hot water, cut fingernails, visit the healthcare facility. If one member of the family is diagnosed with scabies, treat all family members on the same day. The family should obtain a bottle of scabies lotion from the clinic or pharmacy. Apply scabies lotion, which is benzoate, to the whole body. Do not put it on the face. Wash the body the next day and put on clean clothes. Let's look at tinea as a condition. Tinea capitis are ringworm of the scalp. Causes of this tinea capitis: fungal rash. The fungus like warm and moist places, like areas that are sweaty, such as in your hair or on your skin. How is it spread? Touching infected skin, using infected combs or razors, sharing infected clothes, playing with infected animals. Let's go to prevention of tinea. Keep your skin clean and dry. Keep your hair short and head clean. Do not share razors when you get your hair cut. Wash your bedding and clothes after you have been infected. Do not share combs, clothes with those infected. Supportive management of tinea can easily be treated by applying cream twice a day to the area. If ringworm is on the scalp, shave hair off first. Bad cases can also be treated with a tablet. Let's go to jiggers as a common condition. What do jiggers do? Jiggers burrow into feed and lay eggs. One egg of a jigger may turn into eggs and sacs. Over time, the eggs multiply and destroy soft tissue that result in wounds and are prone to infection and diseases. Can also infest hands. Signs and symptoms of jiggers: they produce severe itching and inflammation. Supportive management of jiggers: clean the infected areas properly. Remove the free with the sterile needle. Cover the wound with antiseptic gauze. And you can also ask mothers to remove the jiggers with a fine clean instrument, as she usually does at home. Let's go to another common condition, which is diarrhea. Diarrhea is passing watery loose stool more than 3 times within 24 hours. Causes of diarrhea are eating with dirty hands, unwashed hands after using restroom, germs on hands. Germs transfer to food and get carried to the stomach. You cannot see germs. You can also get diarrhea through drinking unclean water, water from dirty sources. These are ponds, rivers, springs, wells not protected. Water in dirty container. Water has germs that get carried into the body. You can also get diarrhea through eating dirty food, unwashed vegetables or fruit, leaving food out in warm places, food unprotected from flies or animals. Food like this can have germs. Number 4 is eating contaminated food, food that is not cooked enough, food that is left out for too long. When to refer diarrhea? If diarrhea lasts more than 3 days, one should be referred. Adult return to clinic in 3 days. Child return the next day. Prevention of diarrhea. One should wash your hands before eating, after using the bathroom. Mothers wash child's hands. You should also drink clean water. Wash and cook food well. Do not leave food out for too long. Do not leave food unprotected and open for bugs and animals. Make sure food is well cooked. Don't cross-contaminate food. Support management on diarrhea. Diarrhea often causes dehydration, so we replace lost fluids. Clean water, half teaspoon of salt and 6 spoons of sugar or oral dehydration salts, that is the ORS. You also use zinc sulfate. Give easy to digest foods. If it is a child, keep breastfeeding. How to make oral dehydration solution, the ORS. Wash your hands with soap and treated water. Wash container, stirring utensil with soap and treated water. Put 2 large soda bottles of treated water in clean container. Put the oral dehydration solution powder in the water. Stir the solution with a clean utensil. Then add it to 2 large soda bottles. How to use dehydration, or how to give it to the diarrheaing kid? Give 1 large soda bottle ORS each day to babies and toddlers who have diarrhea. Give 2 large soda bottles of ORS each day to children who have vomiting and diarrhea. Go to the clinic as soon as you can. Give your child more oral dehydration solution or breast milk on the way. Let's go to section 2, which is common injuries. Let's start with wounds. An injury involving cut, blow or break which the skin is broken. Minor wounds are skin and flesh just underneath the skin. First aid. Severe wounds or deep are of the body. If not properly handled, can cause infection. First aid, then immediately refer. Supportive management for first aid on wounds: stop bleeding, clean, bandage, give medication. Stop bleeding. You press on the wound with a clean cloth. If bleeding continues, wind clean bandage tightly around the wound. If bleeding still continues, wind second clean bandage tightly on the first. If tight bandage are needed to stop bleeding, do not remove bandage. Second supportive management on first aid is to clean. If bleeding is controlled, clean the wound with water. Use a disinfectant if available. Remove the dirt. Wipe away the dirt with a clean cloth. For every dirt wounds, clean again after 3 days. Use disinfectant if available. Put new bandages on it. How to bandage? Cover wound with clean cloth or bandage. Wind bandage over the wound to hold it in place. Prevent wound from getting dirty. Cover the wound with clean cloth or bandage. Wind bandage over wound to hold in place. Prevent wound from getting dirty. Give medication. Over-the-counter pain medication. Adhere to dose recommendation. Let's go to burns as a common injury. Minor burns, small area of these are burns of the small area of the body, not on face, hands, or feet. The skin is intact. There are blisters on the skin. Severe burns, they are on large area of the body. This should be referred immediately, especially they are on face, hands, or feet. Deep past skin into flesh, very serious and can cause death. Supportive management of burns is treat pain, give pain medications if available, clean the burn, wash burn area gently with soap, water, and clean cloth, apply disinfectant. Then you should bandage the burn, apply clean loose bandage, keep wound clean, check burn area after 1 week. If it is clean and dry, leave it uncovered. If it is oozing smells, start again from step 2. Repeat every 2 days until burn is clean. The step 2 is cleaning the wound. So you should clean the wound every 2 days if it is still oozing or smelling. Supportive management, these are the do's that you should do to the burns. Run cool. Clean water on minor burn to relieve pain. Wash blisters with clean water if they are already open. Give patients lots of drinking water to replace lost body fluids. Give medication to relieve pain. Bath open burns in salty water. For example, you should use 1 teaspoon salt to 1 liter of clean water. Leave wound open if minor or uncovered with loose bandage. Rub fat or grease on the burn. These are the don'ts. Don't break blisters or else the wound can get dirty. Don't bandage burns tightly. The other common injury is a fracture. These are the broken bones. Signs and symptoms that one has a fracture. Limb may be out of shape. Patients may have pain with movement. Patient may have pain when area is touched. Area may be swollen. Supportive management of fracture. First aid. If there is an open wound, apply clean bandage, pressure and cover to control bleeding. Give pain medication. Place body part in normal position. If only a person can manage, may need to gently pull and turn body part to normal positions. Stabilize body part with a splint. Elevate the injury above the level of the heart during transport if possible. Supportive management, first aid. Place body part in normal positions. Stabilize body part with splint. Refer when. Before referral, ensure the patient gets to higher level of care. If travel time is long, consider repeating doses of pain medication. Ensure patients get to higher level of care. Splints. These are for immobilizing injured limbs, only for moving person to receive medical care. Only if you can do so without causing more pain. Splints can be made from every item. Splinting steps. Step 1. Ensure the splint position and limb in the most naturally correct position achievable. Check the status of person's sensation. Gently touch the person's skin on part of the body further away from the torso. Pad the splint to decrease pain and prevent further damage. Apply rigid object to immobilize. Make sure in extent beyond the injured area is both directions. Immobilize the injury above and below. Use broad bandages to prevent any further damage. Recheck the person's sensation. If bandages are too tight, sensation may be diminished. Every 15 minutes until the health facility. Supportive management, back and neck spine. Patients may have pain. Patients may not be able to move. Badly injured patients from more force or accidents may have spine fracture. Badly injured patients must be moved very carefully to prevent further injury. Bites and stings. Wounds from animals or insects. Animal bites. Supportive management of animal bites are treat bites as dirty wounds. So first of all, you should stop bleeding, clean and bandage after every 3 days until healed. Treat pain, refer to ensure there is no infection and to screen the rabies disease. Rabies disease, it's an animal disease passed to people through a bite, deadly if not treated. When helping a person going through a mental health crisis, it is important to look for signs of suicidal. How to tell if the animal has rabies? Foamy, white bubbles at the mouth. Animal tries to bite other animals or people. Acts strange, refuses to eat. If possible, safely match animal for 10 days. If animals show signs of rabies, inform game department. It must be killed and buried to protect others. Patients must be quickly referred to survive. Snake bites. Most snakes are not poisonous, but the timing of the bite is important to tell. If the bite is more than 2 hours old and patient seems well, patient will be okay. Danger if passed after 2 hours. Supportive management of snake bites. Clean and bandage wound. Treat pain with medication. Check on wound in 2 days. If bite is less than 2 hours, patient should show the signs: cough up blood, difficulty breathing, swelling around bite, eyes hurt. Keep the person calm to restrict movement. Keep the affected area below heart level to reduce the flow of venom. Remove the ring or constricting items. Sprint to help restrict movement of the area. If the area sign of shock, lay them flat, cover with blanket and raise their feet. Get medical help right away. Scorpion stings. Scorpion push sharp stinger into the skin. Stinger stays in the skin until it's removed. Stinger releases poison that causes severe pain. In adults, painful but not deadly. Children painful and can be deadly. Scorpions push sharp stinger into the skin. In adults, a larger body can absorb poison, clean wound, treat pain. In children, small body cannot absorb poison, may have severe pain, difficulty breathing, may vomit and diarrhea. Quickly refer to the nearest hospital or dispensary. Let's go to section 3, life-saving skills. Let's start with the CPR. The CPR is cardiopulmonary restriction. Five steps to perform a CPR. First of all, you should access the scene safely. Check the area for any safety hazard that may be harmful to you. 2. Check for responsiveness. Are you okay? Tap the victim's shoulder and shout, "Are you okay?" Look for normal breathing. Look for normal chest raise and fall. Call for help. Start the CPR if not breathing and unresponsive. How to perform adult CPR. Give the chest compressions, 30. Push hard, push fast. 2 minutes in, 100, at a rate of 100 times mean. Give 2 rescue breaths. Head, tilt, chin lift. Pinch nose, give 2 breaths. Mouth to mouth is optional but highly recommended for child and infant CPR. How to perform child CPR 1 to 8 years old. Give 30 chest compressions. Use 1 to 2 hands depending on the size of the child. Push hard, push fast, that is a difference of 2 min each. Give rescue breaths. Head, tilt, chin, lift, pinch nose, give 2 breaths. How to perform CPR on infant? Give 30 chest compressions. Use 2 fingers. Push hard, push fast. You should use 1.5 minutes in. Choking. Choking is foreign object or food stuck in the back of the throat, blocking the airway. How to help unconscious choking adult? Give uncontinuous abdominal thrust. Place the fist in the thumb side against the middle of the adult's abdomen, just above the navel, and cover for the first of other hand. Continue abdominal thrust until the object is forced out. The adult or child can cough forcefully to breathe. The adult child becomes unconscious. If the child becomes unconscious, call for help. How to help unconscious choking child? Give continuous abdominal thrust. Place the fist in the thumb inside against the middle of the child's abdomen, just above the navel. Cover your fist with your other hand. Continue abdominal thrust until the object is forced out. The adult or child coughs forcefully or breathes. The adult child becomes unconscious. Call for help. How to help unconscious choking infant? Place the infant in one hand and then face downwards. Give chest thrusts. Continue sets of 5 back blows and chest thrusts until the object is forced out. Drowning. Respiratory impairment of submersion in liquid. That is what is drowning. Supportive management of drowning. If the person is breathing, place in the recovery position. Treat low body temperature by removing all the wet clothes and uncover with blanket or extra clothing. If unconscious, give a warm drink. Refer if fully recovered. Recovery position, it's as shown on the diagram. Always we should ensure the head is backward to ensure clear way and straighten the head and the neck. Place the one arm at the side, other arm across the chest, and hand against the cheek. Bring far knee up to 90 degrees angle. Roll the person over towards you with the knee at angle and ensure that head is supported. Supportive management of drowning. If a person is not breathing, immediately call for help. Then begin the CPR until help arrives. The CPR, remember, it should be 30 chest compressions and 3 rescue breaths.